أريد بس أركز على one or two important things. تعرفوا حاجة في البلاد بريشر؟ البلاد بريشر عندك حاجتين، hypertensive emergency and hypertensive urgency. صح؟ وعندك hypertension by chance بمعنى بالصدفة اكتشفنا. So, يعني patient comes to you to emergency for high blood pressure because of one of three things. Either they want to check their blood pressure and you discover by chance their blood pressure is high, or they have a symptom. So there are two causes. They come to check their blood pressure and they found their blood pressure high, or they come with symptoms. Right? And we have, if they come with symptoms, we have two things, either hypertensive emergency or hypertensive urgency. Right? الفرق بينهم ايش هو؟ بين hypertensive emergency, difference between hypertensive emergency and hypertensive urgency. What is the difference between the two? End organ damage. Okay. What are the end organs we are worried about? Brain, kidney, heart. When we say heart, means lungs also. Then diamond, heart and lungs together. So, brain, what is the damage that can happen to the brain in hypertensive emergency? Stroke. So either stroke or hypertensive encephalopathy. Hypertensive encephalopathy means the patient is very high blood pressure and they are confused or acting bizarre. Then think about hypertensive encephalopathy. Heart, if the patient is having what? Hypertensive emergency. Myocardial infarction, heart failure, dissection, dissection, aortic dissection. So these are three important things. Kidneys, acute renal failure. Okay, so these are the end organs we are worried about. It's not the eye. It's important. The eye is important, but not for the acute management. Okay. In that case, if the patient is having hypertensive emergency, you want to correct the blood pressure back to, not to normal. You should never correct it to normal. Drop it only 10% from the reading you have now. And also not the systolic blood pressure, not the diastolic, the mean arterial pressure, the one that comes between brackets. You want to drop it by 10 to 15%. Not immediately, over 24 hours we are talking about. So there's no point to try giving medication quickly to correct normal blood pressure. You want to correct it slowly. And the best method with that for hypertensive emergency is to use IV medication, like what? Labetalol. And the dose is 10 milligram. You can repeat it twice or 3 times. You can check the dose. What is the contraindication for labetalol? Asthma. Do you have another medicine for? We have hydrazine. So hydrazine is good, but you need to be very careful because it can crash the blood pressure quickly. Let's assume the patient does not have hypertensive emergency. They came with high blood pressure with symptoms. And usually they come to you with maybe I don't feel well, dizziness, but they are not having any features of hypertensive emergency. So what you will do with this patient?
Advise and follow up and recordings and motivation for recordings, blood pressure and medication.
Okay. If the blood pressure is more than 180 over 100, then you cannot say go home and follow up with your doctor and we'll just give you expected management. You have to do something for it because the numbers are high enough. But before that, ask your patient, what happened that your blood pressure is shooting up? Did you take your medication? No, I forgot to take my medication. Medication. I lost my medication. Or I was taking them, but I didn't feel well, then I stopped. So you know what the reason why the blood pressure is high. So the best thing is to start their own medication, unless they have contraindication to it. Or he tells you, I'm taking my medication, but recently I was started another medication for my arthritis. So non-steroidal and anti-inflammatory drugs are well known to increase the blood pressure. So we know the cause now. We don't need to introduce new medication. We just stop the medication that cause this elevation blood pressure. Or they start taking decongestant for sinusitis or something. The decongestant contains medication that causes high blood pressure. So you need to stop that and maybe switch it to steroids. Okay? So don't rush to correct the blood pressure quickly if the patient is not having hypertensive emergency. Ask history, what happened, why your blood pressure is high. Sometimes he is having renal colic. Treat the pain. Patient waiting outside maybe for a couple of hours for whatever reason, or fighting with the security outside, or having a traffic offense before coming here. His blood pressure is shooting anyway. So make them quiet, give them a chair to sit, then after maybe 5 or 10 minutes, repeat their blood pressure reading. If it is normal, fine. If it's still high, then start for asking why the blood pressure is high. Did you take your medication? Did you take another medicine? And so on. Okay? So I've seen many occasions, not here, everywhere. They are trying to correct the blood pressure by giving them a tablet in emergency. And sometimes the worst of it is trying to give sublingual drops of Adalat, which fortunately we don't have anymore. We used to give sublingual Adalat عشان ننزل blood pressure, which is dangerous. People are living with high blood pressure for a couple of years, and you suddenly drop it to normal in 1 minute, they'll develop stroke because of your treatment, not because of the blood pressure. So there's no rush to correct the blood pressure if the patient is not having end organ damage.
It can lead to spontaneous hemorrhage, like sudden drop of like.
Okay. There we go. Fine. Good. So again, if you see the patient emergency, he is not hypertensive emergency. He is high blood pressure with symptoms. We call it hypertensive urgency. Start their own medication. If he is taking his medication but now he's still having high blood pressure, look for the cause. If there's no other cause, check for what? You need to do lab test. What you will check for? Creatinine, renal function test. Because that's the only thing that it will tell you in the lab if there's anything else. Yeah. So check for the creatinine. If the creatinine is normal, you can send him home with 1 dose of amlodipine to normalize his blood pressure. Not normalize, to make sure that his blood pressure will not go up more and more. So if his blood pressure more than 180 over 110 and normal creatinine, you can send him home with 1 dose of amlodipine, and next day you can go to the OBD to check his blood pressure and manage blood pressure according to the protocols that Rahman maybe have explained for you, the long-term management of high blood pressure. Have you discussed this with Rahman today?
Yeah.
Maybe tomorrow we'll discuss it. Management of hypertension, long-term. في protocol عماني معروف مع hypertension management. That's an emergency. Give them 1 dose and send them home. You don't need to wait for the effect.
Only amlodipine?
Amlodipine. Well,
Captopril?
I don't like it because it's faster. I don't want something fast. I want something.
Could be losartan?
Slow dose.
We in our country we used to prescribe amlodipine and losartan combination.
Amlodipine enough is alone is enough, or you can use lisinopril. It's a good choice. Lisinopril. Lisinopril. The one is Rimapril. Amlodipine. If he is dark skin, you consider hydrochlorothiazide, which is very good, and just make sure he's not diabetic. So, but amlodipine in general, they are safe. Atenolol, we used to give them because of asthma. I don't want to give atenolol for them. So, amlodipine in general is like amoxicillin for infections. So, amlodipine, 5 milligrams, and send them home. I'm not talking about every patient. About patient with blood pressure more than 180 over 110, and the creatinine is normal, and they don't have end organ damage, and despite all the treatment, his blood pressure is still high. Send him home with 1 dose of amlodipine. next morning to the OPD.
Patient with end organ damage, admission, right?
Yes, ICU.
ICU.
But you start the treatment here. In your situation here, I will probably discuss it with the internal medicine في SQH. I'll tell them I have a patient, high blood pressure, he is having, for example, hypertensive, مثلا heart failure.
فيش معناها specialist.
That's fine. We call the specialist في السلطان قابوس hospital. You are working with them now. يعني you are the satellite hospital for Sultan Qaboos Hospital. You are not isolated.
We do it all the time.
They are for you.
All the time with our phone calls.
Okay, excellent. So you need to refer them to them, but you need to refer them in a good shape. So they will advise you what to give in terms of treatment. إذا ما حصلت response منهم بسرعة, you start the treatment based on your judgment, following the protocol for management of hypertensive emergency.
Before referring.
Before.